So let's talk about how patients judge us. Like I said, I already said they're not judging us by your dentistry. They don't know if you're a good dentist or not. They judge us by things like, how great is our website? Is it easy to find our website? How were the reviews about us online? Was it easy to schedule with us or not? How did they get greeted when they called, when they came into the office? Was it easy to schedule an appointment? Was it easy to find you? How about the technology? Are you using the latest and the greatest in your office? How your office looks and feels. I'm not saying they need to come into the castle type office, but if they walk in and you've got, orange shag carpeting from the 70s, the patients are judging you on that. How you communicate with the patients. Are you giving them what they need to know and hear? How are you presenting their case, their treatment, talking about money? All of that is how they feel when they're in your office. How you guys hand off patients from one employee to another, and then how you do your follow-ups. Like everything about everything else except for dentistry. So we want to make sure, and the reason that this is one of the first training courses that I really wanted you to watch was we need to realize how important all of the things that we do matters to our patients, because that's the only way they know to judge us. Now, think about this. Which would you rather be greeted by? The lady, when you walk in the front door of a dental office, is it going to be the lady on the top right or the lady on the bottom left? And I laugh, people go, oh my gosh, of course the lady on the bottom left. But when I was putting this slide together, I looked up the name of these pictures, and the lady on the top right is called dental office manager. The lady on the bottom left is called hotel concierge. So we already have the idea that a dental office manager or coming into a dental office is not a great experience. I would love to be a hotel concierge. They don't have as much to deal with as we do. But unfortunately, we work on teeth, we have drills and needles, we have patients pay a lot of money, and a lot of times people are scared of coming to the dentist. So we need to make sure, even if we might feel like that lady on the top right, even if we're having, one of those days, patients are, telling us, don't you love it when they come in and say, oh my gosh, I'd rather be anywhere but here, or I hate coming to the dentist. Sometimes don't you want to say, we don't like it when you come either, but you can't do that, right? You really got to suck it up and be that hotel concierge. I like to say, fake it till you make it. Sometimes we're just having a heck of a day, but we have to remember what that first impression and every impression is like. Because honestly, it's the difference between people love us on Yelp and people hate us on Yelp. Now, I'm not advocating Yelp here. I'm not necessarily a huge fan of Yelp, but if you were to go out on the internet and read reviews about dental offices, what you will find is the majority of dental offices, the reviews out there, the negative reviews, have nothing to do with dentistry. It has to do with how they were greeted, how we handled their appointments when they called last minute, how we estimated their insurance, everything about their experience with us. And we need to make sure that we're doing everything we can possibly do to make sure that that experience is great. But I get it. I understand. I'm an office manager. I know it sounds great to, Laura, be out there and do great customer service. But after I've been on the phone 40 minutes with Delta Dental and they deny a claim, or we have a patient in the back that won't stop talking and is on their cell phone and we're trying to assist the doctor and it's stressful and we're running behind, it can get kind of hard to keep that smile on your face. And I joke about it. If only I could get so much more done if I didn't have all these patients. But I want to remind you, if it wasn't for the patients, we wouldn't be here. So I understand that we are not, a hotel concierge, they give directions, they help with suitcases, they make reservations. We have all these things to deal with. We all have cancellations and no-shows in our practice. We all have the patients who tell the doctor, yeah, doctor, that sounds great. I want to do 3 crowns. Sure. Then they come up to us and say, I want to do 1 this year, 1 next year, and 1 the year after. We all have drama in the office. Hopefully better, not as much as it has been, but there's always issues. There's always flare-ups. No offense to our doctors, but we have to deal with doctors, which is a whole different issue in many offices. All the time we have patients coming in, oh, I don't have any kind of money yet. They're carrying their Lexus keys. They just got back from Europe, and they've got their iPhone 10 and their Starbucks coffee. And then they say they only want to do what the insurance covers. And the insurances aren't looking out for the best interest of our patients. So we're dealing with trying to help our patients and then only doing what the insurance covers. Equipment breaking, schedule issues, schedule falls apart, lack of teamwork. If only the assistants would help the front more, if only the hygienists would clean their own instruments. We have all that. And then implementing new technology. We have a very stressful, very high energy, a lot going on offices. And I talk about that because I understand. I've been in an office, I've worked in an office, but we have to try to manage these issues. And in other trainings, you're going to see ways to fix and work on a lot of these issues. But we also have to remember that the patients come first. And their experience while we're dealing with all this needs to come first and always be the best. Because 7 in 10 Americans say they're willing to spend more money with companies they believe provide excellent service. So ultimately, and in one of the future videos, you're going to watch a video on why we are all here. Well, ultimately, we're here to help our patients get their dentistry done. And if you think about this, people will spend more money at a company they believe that gives them excellent customer service. Well, when we're talking about treatment planning and case acceptance, isn't that buying? When we're asking our patients to get their dentistry done and pay out of pocket, we're looking for them to buy more in our company because we are here to help them get their dentistry done. So we need to understand that patients are going to spend more, get more done, complete more of their treatment plan, hopefully all their treatment plan, if they feel they're getting excellent customer service. On the flip side, according to American Express survey, 78% of consumers have bailed on a sales transaction because of poor customer service. So even if they wanted to buy a product or get a service done, they pushed it off or delayed it if they didn't feel they were getting the service they deserved, if they didn't feel like they were really getting taken care of. So when we talk about really helping our patients and being here for them as their dental team, we have to realize how important customer service is, because that's how they're deciding whether or not they're going to get their treatment done. And if we truly want to help our patients, we need to understand that, especially if you're in a practice that is looking to maybe get out of network or you're a fee-for-service office. Then you really have to step up your customer service game. So it's super important if we're fully going to take care of our patients.